Welcome everyone to this episode of Tea and Take. I am Dr. Pragya Jaime Marich.
And I'm Dr. Satyavani Gayatri.
And we're back at the scene of the crime. That is where we first met and where the first episodes of Tea and Take were filmed. We're in a slightly different position here at the Amrit Yoga Institute,
We
the
are.
beautiful lake where we have swam in every morning.
Look at this. All the people's back there.
So, as a lot of you know who listen to Tea and Take, Satyavani is an Ayurvedic clinician. And something that I've learned on this journey to the Amrit Yoga Institute with her is that it is not an old wives' tale
Oh, no.
that you shouldn't swim after you eat.
No, it actually is not. There is this concept known as ama, which I think I spoke about on the first episode.
I believe.
But as a review, ama is toxicity that can develop in the body as a result of either food that we take in, or liquid that we take in, or if we do a combination of habits that cause things to be stirred up in the body. So if you eat food and then you jump in water, you take a shower, etc., it doesn't allow the digestive process to happen. And when the digestive process doesn't fully happen, we fall into a state of malabsorption, and then malabsorption can lead to toxicity.
So every morning here we have been doing our sadhana in the darshan room, then swimming, then eating breakfast.
That's right.
Which is a change in how I usually have done my routine here. I've often swam directly after I've eaten. And on the first day, my Ayurvedic mummy looks at me and says,
There will be no swimming.
So let's talk about ama.
Yes.
Because it's...
Well, before you go into that,
Sure.
How do you feel swimming before?
Much better.
Okay.
Much better. I mean, I think a lot of the changes I've been able to make because of Satyavani's recommendations over this last year, all I could just say is less bloat is the best way I can describe it.
One of the first examples of ama reduction, when there is less bloat.
Well, so in our discussions this week, of which there have been many, I wish we could have the camera following us at all times.
That would have been amazing.
That'd been fun. We were talking about this concept of trauma ama, because trauma, which you know is my field of specialty, the idea of unhealed human wounding that can manifest in various ways, physical, emotional, or can happen because of various things, physical, emotional, sexual trauma, or physical, emotional, sexual, spiritual wounding. And really, when we're talking about clinically significant trauma, it's the presence of any unhealed wound. And something I hope we'll be working a little bit more on here in some writing is the role that Ayurveda can play in supporting a trauma recovery process.
Absolutely.
And really how three of these main concepts that are discussed in Ayurveda, ama, ojas, and agni,
Okay.
have some pretty interesting parallels to things that I discuss in my work with healing trauma.
Yes.
So let's talk about a little bit more in depth about ama first.
Okay.
Because something you told me I found fascinating is mental emotional stress
Yes.
can be a cause of where ama starts.
Absolutely. And it actually really is. A lot of people can relate to ama in the body because it's more visible. We experience it in some of the things that you were talking about: bloating, gas, acid reflux, indigestion of any sorts. And when it gets really difficult, it can manifest in the form of pain.
Sure.
But ama actually is a product of the vata dosha. And way back in the day when we were talking about the basics of Ayurveda and the doshas, I had explained that vata dosha is made up of the elements of air and space. And for all intents and purposes, vata is considered the queen/king dosha because it can cause 75 to 90% of the imbalances that exist inside of us. And where that starts is in the mind. Vata is responsible for everything that moves, that is transported and is communicated inside of our mind-body complex, to use the words of Dr. Kamini Desai. And ama immediately starts in the mind when we have an experience, whether it is a thought, whether it is a traumatic experience, a conversation. We maybe get an email or a text message that causes us to have a trigger, a memory, a wound of sorts. And that then gets processed in the mind. And ultimately, if it is not fully processed, much like the trauma therapy work that you do, it can get stuck in the body or stuck in the tube, the energetic tube as we were talking about during our training this time. And when it gets stuck in the energetic tube and it gets embedded in our tissues, then it starts to go to the deeper layers of the dhatus. And it becomes part of us that we carry with us all the time until that work is done to remove that ama, that toxicity.
So if you have followed my work in trauma, specifically connected to EMDR in any way, I hope you're already noticing a lot of these parallels, that until toxicity is able to pass through or move through, it's going to continue to manifest in problems one way or another. And we can try to ignore that it's there all we want.
Yes, we can.
Or say, it's not there, I've dealt with it. But the body will, in fact, as we say in our world, keep the score.
Yeah, it will. And I always say to a lot of my my patients and my clients that if you don't deal with it, you can run, but you can't hide. It will find you.
Yeah.
It will find you.
So aside from not swimming or showering right after you eat, and I know this might be a more complex question that people who consult with you would get answered specific to them, but what are maybe 2 or 3 other just quick and easy practices people can do to reduce ama or eliminate ama that has accumulated?
Absolutely. I like this motion because it reminds me of tongue scraping.
Wow.
So there you go. And I know that you do that
I do
on
tongue
a regular
scrape.
basis. So scraping the tongue. Also, dry brushing can get ama off of the physical body, and of course, a regular meditation and pranayama practice. Because the more that we go inward, the more that we can process those stuck emotions, etc. The mind and the body are inextricably linked, and when we do external practices in the way of Ayurvedic medical care, if you would, it penetrates inside of the mental emotional body.
Sure. And I know from a trauma recovery perspective that even if there may be deeper emotional wounds that need cleansed and healed through professional therapeutic services of any variety, hopefully of the mind-body variety, these daily things that we can add to our routine, to our ritual, is a big part of what I preach or what I teach as getting more adaptive habits formed in the brain. And I've always found that people can do simple things like turning a shower into a meditation. Not after you've eaten, though.
Correct.
But to really savor that sensation of the water.
Absolutely.
Moving over you and maybe visualize it cleansing away. And yeah, it's not going to fix everything if you haven't gotten to the underlying cause, but if you add several of these cleansing or, like the dry brushing idea, rituals on a daily basis, especially if you do it with meditative intent, it can help get you in that right direction. So let's talk about Agni.
Okay. Before we go there, one of the parallels I wanted to point out is that routine that you're talking about from the trauma-informed perspective is what we call in Ayurveda a dinacharya, which is a daily routine. And so there's a lot of parallels that are done from the physical Ayurvedic medical side that penetrate into the mental, emotional, spiritual side that can ultimately assist in trauma recovery.
Right. And when people ask me, well, how many of these practices do I have to do each day? Or how long should I practice each day? My common answer is whatever you can commit to consistently.
Absolutely.
And I think when you can bring that into this idea of daily routine, it ultimately helps to retrain the brain. And I was delighted to hear in Ayurveda there's a word for it.
Yes. When people ask me that same question, I always answer it by saying, just do one thing. Just do one thing. And once that becomes something that you don't think about anymore, then you can choose another one thing.
Beautiful.
Just one thing.
Beautiful insight. So,
Agni.
Let's talk about Agni.
Okay, what would you like to know?
Tell me what it means, because it sounds like a creature in a sci-fi movie.
So Agni is our digestive fire.
A-G-N-I, yes.
A-G-N-I, yes, and it's pronounced Agni, not Agni.
Agni.
And it has a to it. Agni is our digestive fire, and in Ayurveda, everything is linked. So Agni, Ama is to Vata, as Agni is to Pitta.
Okay.
And so it is our fire inside of us that allows us to not only digest food and liquids, but also our experiences. And so what is always happening in the body is trying to balance the Ama so that the Agni operates well. We want to balance our Agni so that we are free of Ama. And so with Agni, it has a direct link to our immune system and our levels of energy known as Ojas. So these three components of Ama, that starts in the mind, Agni, that is linked directly to the gut, as well as our internal processing. It is responsible for our metabolism, our digestion, as well as transformation. So not just transformation in the form of elimination, but also transformation in the form of how do we transform our experiences into something that is positive, or eliminate the things that aren't serving us.
So what I'm hearing there is that this concept is really akin to the idea of just processing.
1,000%.
Whether that be mental, emotional, or whether it be in more of a metabolic connotation.
Absolutely, you nailed it.
All right.
You absolutely nailed it.
And something I was telling Satyavani about is a teaching that I have shared many times. Even back when I was working in rehab, this was something I would share in groups, and it's made its way into some of my writing, that if you think about fire, Pitta is that element.
I have a lot of it.
Yeah, as do I. If you think about fire, let's say in a fireplace, especially in days or in places of the world where you would need that fire to keep a house warm.
Absolutely.
That if the fire rages out of control,
Yes.
you're going to burn the house down.
Yes, you are.
But the answer is not just, well, let me press it away and stomp it out. Because
Not
if
at
I
all.
stomp out that fire and avoid the things I need to process, the house is going to go cold.
I love that metaphor because, yes, if the fire is a conflagration and it's burning the house down, it can manifest itself not only in digestive distress, things like acid reflux or diarrhea, etc., but it can also manifest itself in the mental emotional way, in the way of anger.
Right.
When it is completely put out, then think about when you throw water on top of a campfire. What's there is soot. And that soot turns into Ama. And so not only has it not been transformed and processed in the appropriate way, but it just sits there and is not being processed appropriately, is not being dealt with. And when soot is just sitting on the ground, it doesn't have any energy.
Okay.
And so it has a direct effect on our immune system, as well as our levels of energy that we have, mental, emotional, and physical. And that leads us into that concept of Ojas.
All right. One more question about Agni before
Sure.
we get into Ojas. Just like I asked you with Ama,
Yes.
and again, knowing there's finesse individual to individual, that they'd
course.
have to see a clinician, but what are maybe 2 or 3 simple practices that anybody can do to keep their Agni in balance?
I love that. Keeping the Agni stoked. That's what we call it. Stoked, man.
Hashtag stoking the Agni.
Stoking the Agni. Ginger, including ginger, and spice in general in your food. Not overly spicy, but things like turmeric and ginger are absolutely fantastic. And having meals on a regular basis, on a regular timeline, not having huge gaps in between meals, and also not having irregular meal times.
Got it. So, Ojas,
Yes.
which I have come to understand as the mojo.
The mojo.
There's a technical name for it. So, again, if you were to give mojo's a good,
Yeah,
easy
mojo.
definition, but would you expound on that?
Absolutely. It's your energy. It is responsible for the structure, strength, and immunity and lubrication of your body.
Okay.
So,
Keep going. This is interesting.
okay, so we want to have a fortified body. We want to have strong bones, strong muscles. But our immune system, if that is not operating at an optimal level,
Right.
and it is compromised in any way, it is the breeding ground for disease.
Yeah.
And especially in our culture where we do a lot of overfunctioning.
Really?
We do a lot of overfunctioning. With a lot of overfunctioning that's happening, everybody's immune system is becoming more and more compromised. We're being bombarded all the time with all of these responsibilities and not having any rejuvenation time. So an important factor with Ojas is making sure that you get sleep.
Yeah.
You have to have a nice balance of sleep as well as exercise, or as we have learned over the past 10 days, tension and release. And if our Ojas is not high, or if it's not working in an optimal way, we are open for bacteria, viruses, disease, etc. And the way that you can really notice if somebody has high Ojas or not is you can tell it on the glow of their skin. if the skin is gray or dulled,
Yeah.
you can tell if somebody's kind of worn out.
Right.
Yeah.
And it's interesting because even in watching a film here in our free time, Satyavani made a comment about this individual. You could tell her ojas are depleted.
Yep.
And in mental health terms, we might say something like flat affect or blunted affect even.
Oh, okay.
Yeah.
Okay.
Now, where I really heard a chord struck for me is when you talked about lubrication.
Yes.
Because it immediately made me think of a client of mine who anonymously shared some of his reflections for my book, Trauma Made Simple. And he said, trauma dries you out.
Yes.
It's like having a dry piece of leather where there's no lubrication and there's no flexibility, no pliability with it.
I love that word.
Isn't that an interesting?
Oh, no, it's
yet
dead on.
another comparison here.
It's dead on. When we have flexibility in our mind,
Yeah.
when we have flexibility in our bodies, we have flexibility in our life. So if we have lubrication and we feel like things are flowing smoothly inside of our system, things are well lubricated, our skin doesn't feel ruddy or dry, we don't have popping or stiff or dry joints, if you would, things flow a little bit more smoothly. And so that automatically connects back to how we feel in our minds.
Beautiful. So speaking about rejuvenation,
Yes.
that lake is calling to me.
It's calling me too.
And it's been pretty hot out here.
Very
so
hot.
we want to thank you for joining us for this episode of Tea and Take. And please stay tuned, both in written form and here on the podcast webcast, as we discuss these further blends and meshes
Of Ayurveda and trauma.
between our worlds. There's technically no tea out here, but
That's okay.
It's
We
lake
have
and take.
It's tea and lake today.
lake and take. Chai Bhagwan, everybody.
Chai Bhagwan.